Hello, I'm Courtney Kelly, a registered nurse, and I'm here to talk to you about Cdiff today. Can you imagine having to move your bowels 14 times in an hour, not being able to make a short distance to the facilities to be able to move your bowels? Words like lack of control and urgent become some of your biggest fears when you have C. diff. C. diff is becoming more widespread and identified in more than just the healthcare world. People without schooling in the healthcare field are aware of these superbugs. Research suggests C. diff is becoming an epidemic because it is only treatable, not curable, and with increased overuse of antibiotics, susceptibility is on the rise. Superbug is a pretty scary word, as it should be. This might bring to mind thoughts of giant cockroaches or grasshoppers wearing capes. But this is not the type of superbug I'm talking about. The superbug I'm talking about is C. diff. The frightening part about C. diff is that it is an epidemic. C. diff sickens about 500,000 Americans every year. And every year the epidemic gets 10% bigger, along with the death rates increasing 35% each year, says resource Deneen 2008. Interesting enough, treatment with antibiotics. I know you're thinking, I thought C. diff was caused from taking antibiotics. Yes and no. But I'll get to that a little bit later. Treatment is begun with Flagyl, an antibiotic, but that is not always effective, and there have been reports of cases of resistance to Flagyl, in which case doctors prescribe vancomycin, which, yes, is an antibiotic too. Already, treatments are resistant, slightly unnerving, yes. NAP1 is a type of strain that is resistant to Flagyl, but not only that, it also produces more toxins than other strains. Resource Deneen 2008. Toxins kill protective layers in your gut, which is where a large part of your immune system is, and resulting in increased death. Another form of treatment that is both enticing and unappealing all at the same time is a fecal transplant. Let me say that again so you can wrap your mind around it. Fecal transplant. Over the last few years, fecal transplants have come into play for treating C. diff. There are both fresh and frozen options, neither being better than the other. Because we can only treat and not cure, this is becoming the standard of care for those with reoccurring bouts of C. diff. However, this does not work for everyone. The treatment is done with an enema or colonoscopy, says resource Thompson 2016. There's a screening process to find the right candidate for one's fecal transplant so one doesn't end up with a communicable disease like HIV or hepatitis, says resource Thompson 2016, which could severely complicate recovery. I'd like to draw your attention to my visual aid. Here, as you can see, the CDC has wonderfully illustrated the deadly diarrhea. Its key points, starting with the impact of the disease, has moved on to who is at risk, followed by the spreading, and lastly preventing C. diff, per the CDC 2016. Back to the point of antibiotics causing C. diff. I had mentioned earlier, everyone has acid-altering bile microbes in their digestive tract. When antibiotics are prescribed, they can promote C. diff infections due to these bile-altering microbes being killed off, per the Antibiotic PAVE 2016. These antibiotics are killing the normal flora that is in the intestinal tract. The population these days are quick to go to the clinic or the doctors and request an antibiotic. Doctors are under the pressure to keep patients happy and prescribe antibiotics quickly. People tend to focus on the quick fix and don't give their bodies a chance to fight the infection process without antibiotics. Then, feeling a little bit better, some people don't finish their antibiotics as prescribed, maybe only taking 5 or 6 days of a prescribed 10-day dose. All of these add to the increase of C. diff infections. The disease is also spread fecal-oral, meaning the spread of the spores are in the feces and then they're airborne. Resource C. diff 2009. An airborne spore will say it lands on your hands after you use the bathroom. You touch your toothbrush. Your toothbrush then enters your mouth. Yummy, you now may have caused a C. diff infection. It has been found that patients with C. diff shed a low amount of spores regularly. So good if you didn't wash your hands after using the bathroom, maybe there are no spores. However, when a C. diff patient is treated with antibiotics, there is a dramatic increase in spores that are shed. Frightening enough, transmission of the spores can occur even without symptoms presenting. Resource C. difficile 2009. The elderly are people with certain medical problems that have the greatest chances of getting C. diff. Spores can live outside the body for a very long time and have been found on different items in the environment, per the CDC 2016. Elderly people in the hospital are a pretty common sight. Take said elderly person and say they have pneumonia and are antibiotics. In the hospital, they are at risk for C. diff infection. Preventative measures that can be done are simple as asking your healthcare provider to wash their hands before they touch you. Washing your hands after using the bathroom. Eating yogurt with your meals. And taking a probiotic, per the CDC 2016. Probiotics help put the good bacteria in your gut and are something you can get over-the-counter medications for too, meaning it doesn't require a prescription. In conclusion, research suggests C. diff is becoming an epidemic because it is only treatable, not curable, and with increased overuse of antibiotics, susceptibility is on the rise. First, I talked about the superbug C. diff and the epidemic of the effects of the digestive tract with the death rate climbing each year. Then how treatments are of antibiotics, fecal transplants, but no cure yet. Continuing on with the spreading of spores and antibiotic usage. In closing, I want you to think about when you recalled my patient having 14 bowel movements in an hour. I want you to want to wash your hands, to eat yogurt if you're on an antibiotic. And lastly, give that cold an extra day to see if you feel better before you pressure your doctor for an antibiotic. Thank you.